Hi, my friends. Hi, my family, YouTubers, and for those that don't know me, my name is KK Morphy. Today, I am going to talk about coronavirus, or we call it as 2019 nCoV or 2019 novel coronavirus. So, what is coronavirus? This is characterized by mild symptoms like fever, cough, runny nose, sore throat. It can be more severe to other people and can lead to pneumonia or breathing difficulties. According to World Health Organization, coronavirus for some people become infected but don't develop any symptoms and don't feel unwell. Most people, about 80%, recover from the disease without needing special treatment. However, about 1 out of 6 people who gets COVID-19 becomes seriously ill and develops difficulty breathing. So those people that are immunocompromised and older people or elderly are the ones that are very high risk to get the COVID-19. So how does coronavirus spread? According to CDC or Centers for Disease Control and Prevention, it can be spread by person to person who are in close contact with and about 6 feet. It can be also spread through respiratory droplets produced by cough or sneezing by that person who is infected. It can land to your mouth or nose and can be inhaled through your lungs. So in the United States of America, we had our first case reported in January. That was a guy that came back from China. And since then, it has multiplied. On March 12 of 2020, we had about 1,215 reported cases and about 36 total deaths. And on March 13th, there are about a total of 1,762 and about 41 deaths already. So it actually has spread in many states of the United States of America. 31 of those reported deaths are from Washington State, 4 is from California, 2 is from Florida. 1 in each death of COVID-19 is reported in Georgia, Kansas, New Jersey, and South Dakota. Now, how about Indiana? So I live in Indiana State. So right now we have 12 cases reported but no death yet. So I live close to St. Joseph County, which recently, about 2 days ago, there was 1 case reported. So it's just like about 30 minutes away from home. So as a healthcare worker, what are our preventions? So I work in a nursing home where those elderly are very high risk for coronavirus. So when I went to work last night, I went to the main entrance and then there was a nurse that was waiting to check my temperature. Before she checked my temperature, she had me do the hand washing and then check my temperature. If I have a temperature of 100 and above degrees Fahrenheit, I need to go home. But fortunately, I have 97.7, so I was able to clock in and work for 8 hours. How about those family of our residents or friends? So visitors are actually restricted to come to our facility, in a nursing home facility. However, if it's really, really important, that person, a family or friend, has to talk to the executive director. Then there will be a phone interview or screening. They will be asked if they have traveled internationally in the last 14 days. Have they exposed with people that are positive with coronavirus? And then when they come in, they check their temperature as well. So that's how strict the screening is in the nursing home. How about in the hospital? It's the same. So families and friends that are sick are not allowed to visit. There will be screening as well, and even also for the workers. Gladly, in the hospital that I am working with, and even in the nursing home that I'm working with, we don't have any positive cases yet for the coronavirus. However, we still need to be ready. So what are our preparations? First is we have to limit the spreads of the germs and prevent infection of any respiratory virus. According to American Red Cross, we have to avoid close contact with people who are sick. Stay at home when you are sick. Avoid touching your eyes, nose, or mouth. Now, that is very hard though. However, if it's really itchy, you really have to touch your nose, your eyes, your mouth, or your face. Of course, wash your hands thoroughly. How about washing your hands? 20, as I've mentioned a while ago, about 20 to 30 seconds. Wash it thoroughly. So how you wash it, you make sure that this area here is being washed good, that area, and this area here with your palm. You make sure that you really scrub it good, scrub, and then for those that have ring or those that have watches, you include that part there, the wrist part. Wash it good and put some soap really good. So, and you wash it like that. Include your wrist. Wash. Soap makes you have enough soap, and then wash it with water. Rinse it with water. So water, and then like that. And then you get some tissue or paper towel, wipe your hand, dry it good with paper towel, and then after that, get another clean paper towel, and then you turn off the faucet. And then if you go to work or even at home, you have to make sure you disinfect those commonly used surfaces like the table or the doorknobs, the telephones, the switches, even your phone. We have to disinfect that. How about wearing mask? We have to follow the CDC recommendation for using face mask. Actually, CDC does not recommend for the people who are well to wear mask. Only those people that are very sick or sick, to prevent the spread of infection. The use of face masks is also crucial for healthcare workers and people who are taking care of someone in close setting like at home or in a healthcare facility. So how do we take care of ourselves? Just practice healthy good habits. One of it is eating healthy, eating the right food, vegetables, take your vitamins. I always take extra vitamin C with me, and I drink orange juice during the, before I come to work and when I come home. I eat a lot of kiwi, I eat orange fruit, and I drink a lot of water, like talking about 3 to 4 liters in one day, and sometimes more than that. Also minimize stress. So for me, when I'm stressed out at work, I go to gym once a week and exercise and relax in their hot tub in there. But if there are a lot of people, I don't go. But if it's like very little people in there, especially during the day, it's not that much of people, so that's the time I go. So that's it for now. Stay tuned for more updates. Thank you. Bye for now.